we're not going to be able to enforce every bit of everyone's human behavior in the weeks and months to come. But we are all in the same boat here.
And our future as we chart our way forward through the coronavirus pandemic. In a little while, I'll introduce you to Mitchell Baker. She's the CEO of Mozilla, which is the global corporation that owns the Firefox web browser, and she's a longtime privacy advocate. But first, I'll be interviewing Governor of Rhode Island, Gina Raimondo. She's been widely praised and, of course, courted some controversy for her handling of the outbreak in her state and has just begun a phased reopening of the economy there. Welcome to you both, and welcome to our audiences who've tuned in from around the country and the world. Governor, first a question for you. Just this past weekend, you began a reopening. You lifted Rhode Island's strict stay-at-home order. What was behind that decision? Was it economic incentives, or are you convinced that you've actually flattened the curve enough?
Yeah. So good morning, and thank you for having me. Thank you for this coverage. No, it was the data which showed that over a consistent period of more than 14 days, we had seen a plateau in our cases, a decline, a steady decline in our hospitalizations. That's what I had my eye most firmly on. A very steady decline in our percent positives. So Rhode Island has been very aggressive around testing. At this point, we've tested nearly 10% of our population, much more than most states. And at the same time, we've been ramping up our testing. We've seen a steady decline in the percent positives. So what I have said to the people of Rhode Island is we are not out of the woods. We still, unfortunately, are seeing hundreds of new cases a day. However, the trend in the curve, as you say, has certainly plateaued and declined over a period of time, and it gave me the confidence to begin the process. This first step, though, phase one, I've called testing the waters. This is a slow process. I'm encouraging people to put a toe in the water. Let's do that for a couple of weeks. Let's study that for a couple of weeks, and then we can take that next step.
So let me ask you about one of those toes in the water. On May the 18th, you've discussed reopening restaurants outside with very strict guidelines. Some of those guidelines, how are you going to enforce them? They include asking patrons, I believe, to register their contact information. How are you going to make sure this happens?
Yes. So you have put your finger on perhaps one of the key issues that every governor faces, that we as a nation face. It's like every decision we're making now, every governor is in a tough spot. Everything is a balance. I like to say that I have no good options. Option A is a poor option. Option B is poor, and I have to choose between, two difficult options. Balancing, in my judgment, public health with economic health. So there is everything I'm doing is designed to encourage and support voluntary compliance. We aren't taking a heavy hand with compliance. We will enforce. There are penalties. There are civil fines for not wearing your mask. We have substantially ramped up our inspections. I have a whole COVID inspection team that we've created, more health department inspectors, more business regulation inspectors. But really, my approach is, as I said, encourage, support, enable voluntary compliance. And honestly, my view is I'm leading from a place of confidence and trust in the people of Rhode Island to do the right thing, because really, it is in their interest. If you're a restaurant next week who opens and pushes the limits, then we'll see cases go up and I'll have to pull back. Right? You won't be open. And so it's their incentive to do the right thing. Sorry.
Of course, there will be a delay, of course, before you see the results. The face mask that you just raised, of course, is a highly controversial issue and a politically controversial issue across the country. I think you've had 75% compliance in the state. Do you hope that's going to go up now that you've signed an executive order mandating the use of face masks?
I do. I do hope it's going to go up. What we've seen is about a 95% compliance among employees who were in retail shops and grocery stores. I think that's fantastic, and I salute each and every one of them who is taking the simple but life-saving step of wearing their mask. Yeah, we need to do better than 75%. And, listen, I know it's strange. Some people think it's unnecessary. It feels weird. I wear mine. It's warm. It's hard to do. But here's why I'm doing it. It's simple. It's inexpensive, it's highly effective, and it is much better than closing down whole parts of our economy. So if we have to endure some embarrassment or discomfort in order to get thousands of people back to work, then I think, we need to do it.
You're sitting between two hotspots, Boston and New York, and the summer tourist season's coming. What are you going to do to ensure that people who come into the state during the summer abide by your wish that they quarantine for 14 days?
Yes. So this is a concern. I will not sugarcoat this. Throughout this crisis, I have stayed true to innovating. I say we have to innovate, and I've stayed true to being very honest with the people of Rhode Island. So I'm not going to sugarcoat this one. Rhode Island depends heavily on tourism in the summer, and we need a plan to figure out how to keep everybody safe and also enable some tourism. So we're making that plan. I don't yet have the answers. Things we're thinking about, testing tourists. So figuring out a way that we can have such robust testing that if folks are coming here and staying for a while in Rhode Island, let's test them to make sure that they are negative.
Which takes me to a question about your testing, which has been immensely successful. I think you've had a 5% test rate compared to, say, 1% in Georgia and Texas. How did you get those resources, and how are you going to manage your huge goals for going ahead, which are, I think, something like 10,000 a day by July and 20,000 by September? Do you have the resources?
We do, and we're going to find them. Not doing it is not an option. We need testing, we need contact tracing, we need symptom monitoring. These are the things that are necessary to safely reopen the economy and to give people confidence that when we do it, it's safe. So what I've done is really innovated and partnering with Salesforce, partnering with CVS, partnering with SurveyMonkey, partnering with Amazon Web Services. We have to get creative. It's not okay for me to say to Rhode Island, I'm sorry, I can't figure it out. So, we're going to get there. I've set these goals, and one way or another, we're going to figure out how to make it happen.
And you're partnering with neighboring states, right, over the supply of PPE, the protective equipment that people need. Have you had the resources you've needed and the help you've needed from the Trump administration, the White House?
So let me say two things. We are partnering. I've joined a 7-state coalition in the Northeast, and I want to give a big shout out and word of support to my fellow governors, all of whom is working hard, because a lot of people who are going to come to Rhode Island's beaches are from Connecticut or New York, and vice versa. Lots of people are going to want to go from Rhode Island to New York, so we have to collaborate, and we are doing that. I would say the federal administration has been behind from the start. From the very beginning of this, they were slow to react, slow to reach out to states. In the beginning, it was so dysfunctional. We couldn't really access the PPE in our stockpile, et cetera. Over the past 10 weeks, the federal government, like all of us, has gotten better at dealing with it, has been better able to help states fulfill our needs and fight the crisis. So now I think, obviously, we're in a much, much better shape, getting much better support from the federal government. But they played catch up for a long time, and that really set us back.
Well, it's not all rosy, even in a small state like yours. I think you have a population of about 1 million. 24% are Black and Latino, and 57% of the cases are in those populations. What are you doing to address areas like Central Falls, which is a hotspot in your own state, but the more general problem of minorities being disproportionately affected, not only by the virus, but also in access to technologies that they need in order to be schooled from home and know what's going on?
Yeah. So look, you're asking all the right questions. These are quite literally the things that keep me awake at night. And you just put your finger on a big one, which is places like Central Falls. It's a very small community, disproportionately poor, disproportionately Latino, and disproportionately affected. And that isn't okay, right? It's not okay. I am committed to equity in our response, and we're not going to rest until every single Rhode Islander, and I mean every one, has access to the testing and support and health care that they need to get through this crisis. And we've done a lot, but there's a lot more to do. One thing that we're working on, leaning into with some success, are walk-through testing sites in the community.
So let me take you to one of your major technological innovations. You've talked about a one-stop app. What are its functions and how will it help these minority communities, among others?
So, so perfect example, when I was saying, like, in Central Falls, poor community, lots of people don't have cars, they need to get tested. So we've set up shop in Central Falls and Pawtucket in the parking lot of a school. The community can walk there and they can get tested. Now, the app that we're hoping to roll out soon would allow them to go on their phone or on their computer, order that test, walk over to the testing center, go ahead and get their test, be notified on their app if it was positive or negative. If it's positive, immediately be notified on the app. Different options for them to isolate. Let's say they live in a crowded house. Let's say they live in a house, 10 people, 2 bedrooms, 1 bathroom. Well, then we need to help them get to a place where they can isolate safely. Symptom monitoring will also be on the app. Tell us how you're feeling. So we are hoping that this app will make it easier for us to meet the needs of Rhode Islanders and meet them where they are.
Let me ask you a question from an audience member. This is Anne Roth from Rhode Island, who asks, I'm going to read her message. If I did sign up for a contact tracing app, could you guarantee that my information would be deleted after the crisis is over? What guarantees would I have that the state would not sell my information or use it for other purposes?
Such a good question. Thank you for asking it. The answer is yes. So let me, if you wouldn't mind, give me a second here.
Right.
Privacy and data protection are paramount. First of all, I believe in them as values. And second of all, everything is about giving people confidence. We want voluntary compliance. No one's going to be forced to do this. This is opt-in only. I hope everybody chooses to, but I'm never going to force you to, which means I need to give you confidence. If you opt in, your data is safe. So let me tell you how we think about it and to answer Anne's questions. Your data, not even the company providing the app to us will have access to your data. The only 2 people that have access to your data are you, Anne, and the Rhode Island Department of Health. Rhode Island Department of Health only gets the data if Anne says they can have it. She has to give permission. And then they only keep it for as long as is necessary to complete the case investigation. So that is weeks, not months. It's then automatically destroyed. And we will not sell it, absolutely, 100%. It will never get into the hands of a for-profit company, and it's protected by HIPAA.
Thank you, Governor Raimondo. That was fascinating. Thank you for sharing your efforts for how to control the virus without exerting excessive control over the citizens of Rhode Island. We're going to take a short break now for a video, and then I'll be back with Mozilla CEO Mitchell Baker. Thank you very much.
Thank you.
your assessment of it and how it would work and the pros and cons of such an app in other states as they might roll them out?
First, I'll say it's clear from the governor's comments how many different aspects need to be weighed. She described economic health, physical health, and of course, privacy, or in the bigger picture, what's my relationship and my data, what's the relationship to the government? So there's a lot to weigh in there. And the policy outlines of the governor's program have a strong privacy focus, as she mentioned. So there are a few things in there that we think are important. One is voluntary, though I'd like to talk a little bit more about how voluntary something really is. But it has a voluntary component, it has a very limited access to data, and it has a use limitation on what the data is used for, and it has a destruction of the data afterwards. So as design principles, those are all very positive. One would want to make sure that not just Rhode Island, but any other implementation actually had the practices to carry those out. So it's easy when you begin to think, oh, this will only go to the Department of Health. But unless you're really sure and you put that in place, if the data is useful, data tends to travel. So you would really want to know exactly what is limiting where it goes and whether that can be changed and how easily, whether it actually gets destroyed or not. It would be very surprising to find that your employer had all that data as well as you, or that your employment was conditioned on those sorts of things. So as policy outlines, the governor is clearly trying to take her privacy values and focus and put them into the policy. So there's a fair amount of execution in that. But as a privacy, as a balancing between all the things that she's got on her mind, it's clear that the privacy aspects are in there. So that's encouraging.
Good. Actually, for these contact tracing apps to be effective, you need a fairly large buy-in or opt-in, don't you? And I think Oxford recognized about 60%. Is that true? And do you see that as a potential future for these apps? Are people going to opt in?
Well, two things. Whether 60% is the right number or not, I'll leave that to the experts. I'm not remotely a public health expert. I think the opt-in piece, that actually depends on how voluntary something is. Like, I don't have a particular estimate of my own of how many of us will individually decide we want to opt in. But it is certainly possible to make something difficult not to. So, for example, take any piece of software that you use, or the phone, or any app you use. Like, in theory, you have the ability to not opt in. But in fact, in reality, you can't not opt in to the terms of your Android phone or your iPhone. I mean, those are the options. And so, yes, it's voluntary to opt in to whatever it's in those documents. But in reality, you can't. If you opt out of those, you're not, you don't have a smartphone. So I think the question of how many of us opt in is partly how many of us want to in the beginning and how limited we are if you don't opt in. Right. So if you don't opt in, can you go into a grocery store? Can you go into a drugstore? Can you do any of the other things that you actually need to do? And so it's very easy for that to become coercive. So I'm going to leave the predictions of how human beings, in a particular state, act to the experts. But just note that what starts out as voluntary with all good intents can easily become quite coercive.
Absolutely. One of the questions I had actually before we move on is to sort of look at some of the terms of art that have come out about centralized and decentralized systems, the use of Bluetooth or location data. People talk about centralized and decentralized. What's the difference?
In this case, the difference is where your data lives and who has control of it. So one of the design principles in the app that the governor outlined is a centralized piece where all of the data goes to the health authority. And so of the sort of privacy protecting principles, as we talked about, there are many in the app that Rhode Island is looking at. This one is not. This is the Rhode Island one is a centralized system. So that means that the information about you leaves your phone and travels to the health authority and lives in a big centralized database or system there. So that's a centralized system because all of your data is being gathered in one place. And so anybody who has access to that place has access to your data, but of course all the other data as well. A decentralized system in this setting means that your data stays on your device. And you would get notifications that would come to you. So let's give an example. Let's say it's a proximity tracing. This is so Bluetooth, for example, is a proximity. It's designed for devices to be able to communicate when they're close together. And so it gives proximity information. And in a contact tracing app, it would be what other phones were you near? It's that proximity piece. Whereas location data is exactly where are you? Where did you travel? What's your history of where you went? And in a decentralized system, all that information remains on your phone, and someone like the health authority would send information to your phone, and it would be able to make the connections for you.
And I could then decide I need to go and get tested because I've been close to somebody who potentially has the virus. It would come down to me to make the decision.
Yes.
So Google and Apple are collaborating. I think Microsoft has been working with the University of Washington. Has Mozilla volunteered, or would they consider vetting any of these apps to advise on what makes sense?
We offer to a range of projects privacy and security, say consulting and that, like how to think about it and what to do about that. I think with Apple and Google, they certainly have the expertise, and we would love to help as much as we can. It's not that those organizations probably don't know about privacy, so they haven't come to us. Many smaller projects have. We have also a small grant program for more open source projects. So we are engaged in a fair amount of privacy and security, but not with the big tech giants. And actually, that leads me to add, there's one other principle of these apps, which is open source. Because if a piece of software is open source software, then of course we can see what it does. Like not each and every one of us, but the technically sophisticated or the programmers among us can actually look and see if it's doing what it says it is. And that might be difficult when you're using, for example, the whatever companies Rhode Island is partnering with, because their products may not be open source. But that means you just have to rely on someone else to know what's happening. So in the long run, if we're building these things, you really want them to be open, because that's how you make them trustworthy.
So what questions should be asked of public health officials and governments who are proposing to deploy apps of this sort? How should we be approaching the questions to ask them?
How do we ensure, and how do citizens know what's actually happening? What data are you collecting? Where is it going? How is it being used? And when and how is it destroyed? That's the first set of questions. How do we know? There's a set of principles in it, but what's the effective enforcement mechanism for those things? And how would you know? And thus open source is one of those. So that's the first set, is actually understanding what's happening now in the middle of the crisis. A second thing is we should put in very explicit timeframes for reviewing these. Because in the middle of a crisis, we may all, like individually or as a society, decide that the government should have far more ability to look into our lives or surveil us or spy on us or take data off our phones and do something about it in the middle of this crisis. But we certainly want to look at that and see if we want to remake our society that fundamentally over time.
Right, and I guess this extends beyond privacy, right, to other sorts of rights that we have more or less willingly given up by being locked down in our homes and wearing our masks and other things. That these are basic rights of our society that we've given up temporarily, and we'll want to know that we can get them back.
Yes. In general, in the larger setting, I think we've seen that with this global network we call the internet, that many of the balances between an individual and their government, or an individual and privacy or personal security, are changing, and that it's very easy to know more about each one of us than we want. And so that evaluation of what does it mean to be in a democratic society? What does individual liberty actually mean? Like how much surveillance and other people knowing what I'm doing and manipulating me, and maybe the government doing the same thing. Like all of those questions are very real right now. And the pandemic makes it clearer, sort of magnifies those. But even after we understand how to deal with this virus and society returns to a more normal state, we have these larger questions about data collection and the state and the individual.
And data and actually the internet connections have become so fundamental to everyday life for school children, for other people. I have a question from a reader that I'd like to read to you. This is from Elizabeth Wisnier from California, who asks, what advice would you have for students, parents, and educators wishing to protect their privacy during distance learning? People at home teaching and...
Yes. Well, there's some things an individual can do, but there's a bunch of things that really we have to tackle as a society. So first of all, I would look to, first of all, do you have any options? Sometimes for your child to participate in the education system, there's only one option. And so the privacy and security and personal security posture of that option, that you need to deal with the school group on. I would look to, so for example, at Mozilla, we just published a privacy guide for teleconferencing apps. Everything from Zoom to Signal and what to look for. And so if you have a choice among different apps, you can make those choices. The third thing is you have to, kind of, assuming you have a choice, which if you don't have a choice, then it's a political question with your school group. The things, one of sort of the secrets is that a lot of the big platforms will offer an enterprise version or a paid version of something. So for example, if you want your email to be treated by Google differently, so it's not ad supported, right? Enterprises can pay for more privacy. And so it's possible out there, but it usually requires funding, which of course school boards often don't have. So we have those kinds of questions to actually look at.
Right. I mean, things like public schools relying on Google Chromebooks, are those vetted to protect a child's privacy?
For that, you'd really have to talk to Google about, exactly what they're doing. I will say that despite the what we call the techlash, and there are, so many people inside these companies that want the right thing and want to care for children. So you just have to ask and right. See what the process is.
And talking about caring for children, again, people are working from home. It's all very well for those of us who have broadband. But is Mozilla doing anything to extend broadband to people who do not have it, who have difficulty with internet access and are now struggling even more?
Yes. We're not a hardware or an internet ISP provider, so you won't find Mozilla in the field, with a network. But we do a range of things. And we, for example, we partnered with the National Science Foundation to run a program for identifying and grant making and sort of seed funding for a range of projects throughout the United States for underserved communities. That's a perfect kind of activity for us because we're not, as I said, we're not an ISP or an actual provider. So we've done a range of things along those lines and a fair amount of policy work and also community networks. One of the issues with often rural broadband, both it is policy related to it and what kind of community networks or municipal networks are permitted. And there are some places in the United States where it's actually not permitted to have a municipal network that serves a local community. And those are policies that should change. So we do a fair amount of work on that level as well.
I think I have time probably for one last question. And you've been talking theoretically about privacy and what it means for other people, but has the urgency of this pandemic changed your personal views about what kind of data you're willing to give up or the parameters of that?
Well, I'm pretty far on the edge. I would say a bit. I've moved a bit. I'm always a laggard in sharing personal data. But also, women and being public and being stalked, I would say I'm moving, but I'm probably not as far as most people. And really, in my case, the guarantee of, is it temporary? When do we look at it? How are we sure we're going to shut it down and reassess what a modern democratic network society with health concerns actually needs? And I think like the app, sometimes I think like these apps, they're important. So I'm not saying we shouldn't do them, but they also feel sometimes like a sort of quick fix. And there's a lot of public health policy, that would go a long way in this pandemic as well.
Good
So
old
also see a little bit broader range before I dive completely into the total sharing.
Well, look, thank you, Mitchell Baker, CEO of Mozilla. Thank you so much for joining us and for opening our eyes to some of the benefits and also concerns about the kind of data sharing we may be facing as we try to innovate our way through the end of this pandemic. Thank you to our audience today. Tomorrow we'll be back at 11 a.m. Eastern for the next in our Path Forward series. That'll be with guest FedEx CEO Fred Smith, who will be interviewed by Washington Post opinion editor at large, Michael Duffy. And please register at WashingtonPostLive.com. WashingtonPostLive.com. Let's get that straight. WashingtonPostLive.com. Thank you very much for joining us today.